So if you have a patient with diverticulitis, what investigations will you request for? Number one, what investigations will you request for? There will be elevation in the C-reactive protein. But remember that C-reactive protein elevation is not specific. So the investigations you need to request, C-reactive protein should be part. You should also request a complete blood count, focusing on the leukocyte count. But the interesting thing about diverticulitis is that the leukocyte count may also be normal. Okay, leukocytes may be normal. And then you also want to do serum amylase and serum lipase, because we learned that in patients with chronic abdominal pain, they may have varying differential diagnosis. Okay, so serum amylase, serum lipase. Serum amylase and serum lipase are usually expected to be normal in diverticulitis. However, if the patient has perforation or peritonitis, serum amylase and serum lipase may be high. Please let me take it again. Under normal circumstances, regular run-of-the-mill diverticulitis, serum lipase and serum amylase should be normal. However, if the patient has peritonitis or free perforation, then amylase and lipase may be elevated. So this is also something we need to pay attention to, that it is not every elevated lipase and every elevated amylase on your board exam which points to pancreatitis. There are other reasons why a patient may have elevated serum lipase. For example, if the patient has diverticulitis, which has perforated, or if the patient has diverticulitis, which is now causing peritonitis, their lipase may be elevated. So don't be tricked. It is not every elevated lipase and every elevated amylase which indicates pancreatitis. Next, because of, the fact that the diverticulitis can be suprapubic and can also give us a urine presentation like dysuria, like frequency. You also want to do a urinalysis. And when you usually do the urinalysis, you realize that the patients will have sterile pyuria. And even though there's pyuria, it is sterile. Why? Because the inflammation is not in the bladder itself. It is in the adjacent colon, but it is rubbing on the bladder. That is why the patient is presenting with frequency, dysuria. So it is not everybody who presents with frequency and dysuria who also has urinary tract infection. Diverticulitis can also do that. You also want to do serum electrolytes. Why? Because assuming the patient has had a perforation or the patient has peritonitis, it can be a very bad case, right? And you realize that if you're suspecting, like this patient is presenting with dysuria, and you do urine culture, usually you may find organisms which should only be found in the colon, in the urine. If you notice that, then you are thinking about the fact that there's a fistula between the bladder and the colon. So if you start seeing organisms which should solely be seen in the colon, you start seeing them in the urine, it should alert you that, look, this patient may have colonic vesical fistula as a result of diverticulitis. And if you have a female who is in the childbearing age and the patient presents with lower quadrant abdominal pain, even though you are thinking about all these differentials, one differential you cannot miss, or one investigation you cannot miss, will be to do your serum beta HCG. In abdominal pain in any female of reproductive age, please, doctors, please, Dr. Boni begs you, make sure that you request a serum beta HCG.